My name is Malika Carter.
My name is Lucinda Canty.
Good afternoon. I'm Nakia Grayson.
Good afternoon, everyone. I am Angela Smith.
Good afternoon, everyone.
My name is Kunwal, and so great to be here.
So I'm excited because I have a new book out.
Greetings, everyone. I'm so happy that you're here.
So I'm just going to do it like a really brief overview of midwifery.
My great-grandmother graduated from Hampton in 1908, and her mother was a midwife in Lynchburg, Virginia. She was a midwife / baby nurse, so I think it's imperative that we increase the number of Black and Brown people in the midwifery sphere, that we reclaim our history, that we focus on equity as it relates to birthing. And so that is my why.
I just want to also highlight that we are moving forward and moving towards creating a midwifery education program in HBCU. So that's what we're fighting for with this grant, and that's what we're fighting for.
Why are we not graduating midwives to go and work in our communities to work on improving these healthcare disparities? And so that is why it is so important for us to have these programs housed at HBCUs.
I'm a nurse and a nurse midwife, and I currently am a associate professor at the University of Massachusetts. I'm also director of our Seed Works and Health Equity program to increase diversity in the nursing and midwifery workforce. And history is something that has always been important to me because I realized how much of my history I was not taught.
I went to a historically Black college, and I will say that I did not study nursing or midwifery initially, because I did not know that it was an option. And what we're seeing is that a lot of people are coming into midwifery as a second career, usually because of some experience they had in the community or some injustice they may have seen. But I became a nurse midwife because of that, for that very reason. I'm trained as an anthropologist and public health practitioner, and saw some things in our community and the way people were being treated, and also our maternal and infant mortality rates in Memphis were extremely high. And I wanted to do something about it, and I started to do more research, and then talking to older Black women in our communities, they told me about these midwives that served them and how they gave birth with these midwives in their community. And I was like, we don't have any Black midwives in our community. What are you talking about? So I saw it as a call for me to see a restoration and reclamation of midwifery in our community.
My new book is out, Listen to Me, Good Was the First, and Safe in the Midwife's Hands is the Second. And this book really focuses a lot on connecting the traditions of African-American midwives with the traditions of culturally based and practicing traditional midwives on the continent.
So a lot of the history I had to learn just about, especially midwifery and nursing, I had to learn on my own, to learn about nurses of color, to learn about midwives of color.
I understand just how important, how critical it is that we have some programs at HBCUs, and that connection with starting these programs to advancing healthcare, maternal healthcare in communities.
For me, I was a nursing student before I even knew what midwifery was. And so I went into nursing, and I always had a love for pregnancy and babies.
As we know, there are many different paths to midwifery. There's not a one-size-fits-all.
If we were to take a snapshot of midwifery education programs across the U.S., you would see that there are many programs that are housed in schools of nursing, although I want to highlight that not all are housed in schools of nursing.
What I'm really here to talk about today is birth equity and collaborative care. So how do we foster social justice as a collective response through community engagement?
I was raised and primarily lived in rural Missouri growing up, and so I saw, the lack of access of care, inequity, and just I think all of these personal experiences really guided me into thinking about, what is happening and how can we do better.
Right now, in terms of the diversity of our midwifery force, as you can see, that 85% of the midwifery force is white. So in that 15% that's left, only about 7% are African American, and then you have multiracial, everything else. And of course, 90% of midwives are non-Hispanic or Latinx.
Thank you for joining us today, and we look forward to continuing this conversation.